Today we ask the question, how old is too old to have a baby? We're getting this conversation started to break the silence and the shame surrounding infertility. So let's look at the facts. The chance for a natural birth after age 40 is 5% per month, and it decreases as you age. IVF has an 85% failure rate for women over 40, and one cycle can cost upwards of $15,000.
Take your time, build your career, and decide at what age you want to become pregnant. And you've heeded that advice, embraced that concept. Today, 1 in 5 women postpone pregnancy until after age 35. And over the last 15 years, there has been a 50% increase in first births to women over 40. Pop culture and celebrities make embracing the concept of later motherhood seem easy. But can putting off pregnancy until your mid to late 30s be a life-altering mistake?
Dr. John Jane is joining us. He's a specialist on infertility work. He helps women get pregnant well into their 40s. So, Dr. Jane, why shouldn't we draw a line in the sand at age 40?
Well, you know, a couple things. I think one important thing Jennifer mentioned is that as women get older, the opportunity to have a baby definitely declines. But there are many women who've had babies in the early 40s, not just from egg donation. There's actually 4 million babies born from the process of IVF over the last 30 years.
I understand medically what the problem is. But the other problem is that socially, for a female, many females to find a mate that's compatible, that they want. Where is Mr. Right? Mr. Right is not necessarily there. That is a social reality, and we can't ignore that.
This is why we're doing the show. If it was easy to answer, there wouldn't be debate. I showed you information today from our survey that half the women think age 40 is fine, half don't. So, Dr. Jane, let me ask you a question. I'll be very blunt about this. Are we giving women false promises when it comes to the likelihood of them getting pregnant as they age?
I think we're giving women information, and that information can be processed in many different ways. But for some women, they may say, I'm not going to waste my time and money on this. For others, they may say, I need to give this a go at least one time to, in my mind, make sure I'm not a statistic.
Just explain to me what science can now do for these women.
So there's 2 parts to it. One is it's a relationship with the patient. It's about being transparent and giving them real expectations, and expectations based on a variety of different treatments. So the type of treatments that we can offer women start off with just simple counseling sometimes as to when to have sex. The egg is only good for 1 day a month, 24 hours. So having sex at the right time is important. Other more advanced treatments involve taking a tablet form of fertility medicine called clomiphene citrate, or injections of a hormone called follicle-stimulating hormone. The idea being that we recruit more eggs. And then we combine that with artificial insemination to increase the odds. From there, we move into in vitro fertilization. In vitro fertilization requires several steps, but the goal of in vitro fertilization is to create multiple embryos to increase the chance of it working. If that doesn't work, we move on to egg donation, because oftentimes then it's the egg that we have to replace to achieve a pregnancy.
Unfortunately, because our eggs are more mature, the incidence of you having Down syndrome or any other chromosomal abnormality, unfortunately, increases as well. Just to give you an idea, in our 20s, that chance is 1 in 1,400.
Okay.
Are you ready for this?
Yes.
In our 40s, it's 1 in 30. When you're 45, it's 1 in 12.
You're kidding me.
No.
So, Dr. Jane, we just heard about complications for both the mom and the child. How seriously do you take these issues?
Oh, we take them really seriously. I mean, the patient's going through all this trouble to have a baby, and I'm trying to help them have a baby. I want a healthy baby. So, I mean, there's things we can do ahead of time, screening patients and counseling them on risk factors and modifying risk factors if we can, and sometimes saying it's not a good idea.
So I want to ask yourself this question. Are you willing to sacrifice your financial and your personal independence in order to have a baby? That is the fundamental question. Remember, deciding when to have this conversation or not to have it at all is your choice. There is remarkable science out there that allows you to have a baby later in life. It's magical, it's fantastic. But the most important thing we must do is to move decisions about your fertility to the top of your priority list by the time that you're age 30. That's my advice.